Good morning to you all, and welcome to today's webinar for the Ohio Opioid Technology Challenge, Topic 4, Protect, brought to you by 9 Sigma. My name is Jonathan Yakasha from 9 Sigma, and I'll be your host and moderator today. Please note that this webinar is being recorded. The recording and transcription will be made available on the Opioid Technology Challenge page. Let's review our agenda for today. After I introduce our speakers, they will discuss the project in greater depth. We'll conclude by addressing your questions during the live Q&A session, followed by a brief summary of important project information, including how to request additional information or assistance. As we proceed through today's presentation, please feel free to ask your questions at any time. We'll keep track of your questions and respond to them during the Q&A portion of the webinar. Should you need any additional information or assistance outside of today's webinar, please feel free to contact the 9 Sigma Provider Help Desk at phd@9sigma.com. At this time, I'd like to introduce our panelists for today's webinar. First, we're joined by Ethan Karp, PhD. He's the CEO of the Manufacturing Advocacy and Growth Network, or MAGNET. And from 9 Sigma, we're joined by Kevin Andrews, PhD, Senior Program Manager. Gentlemen, thank you both for joining us today. We'll begin with Kevin Andrews from 9 Sigma. Kevin, could you please give our attendees an overview of this challenge topic?
Thank you, Jonathan. So the challenge is a 3-phase prize-based competition to find technology-based solutions that address the opioid crisis through addiction prevention and treatment or overdose avoidance or response. Next slide. The challenge has 3 phases. We've completed phase 1, the idea phase. We are now in phase 2, the challenge phase, which has up to 12 $200,000 prizes. The challenge phase winners will then be able to compete in phase 3, the product phase, with submissions due in July 2019, and the prizes that they compete for are up to 4 $1 million prizes. So the 4 topics of the challenge phase are broadly characterized by these 4 theme words: diagnose, prevent, connect, and protect. And the focus of today's webinar is topic 4, protect.
Great, thank you, Kevin. At this time, we'll turn things over to Ethan from Magnet. Ethan, could you please give our attendees some additional information about this particular topic within the overall Ohio Opioid Technology Challenge?
Absolutely. So a little bit of background. I'm here speaking to you. I run an organization that helps companies think of and launch new technologies that help many industries through manufacturing. And today we're talking about one of those 4 areas of this technology challenge that is very aligned with making new technologies that, in this case, help first responders prevent accidental exposure by opioids. So toxic exposure, there are many individuals who are at risk and could be hurt by this, as listed here. And what we're really focused on in this particular section of our challenge is around those first responders and drug enforcement agents, people that would accidentally come in contact and could be hurt by opioids. Next slide, please. So first of all, as you're likely aware, and if you're not, the opioids that are so potent out there are extremely deadly, not only to those who use them, but to those who come in contact. A little picture of a penny here. It takes 2 to 3 milligrams, which is exactly the amount shown there in white, to induce some sort of respiratory depression or even possible death. That's all that you need to come in contact with, and it can be absorbed in your skin. It can be absorbed by inhalation. It can be absorbed through your eyes, through your nose. So basically, getting in contact with this drug could be extremely harmful. Next slide, please. If you're in the field and you're exposed, the problem is, and this happens when you talk to any first responder, that it's very hard to tell if there's going to be a drug, an opioid, in whatever the call is. So talking to field officers, they'll say, look, 50 times in the last couple years, we've been exposed to, me personally anyway, have been exposed to some sort of opioid. And that might be surprising. When you dig into that, it's not just, oh, it was in a baggie, right? No, that teeny little thing maybe is wrapped in a lottery ticket. And that's the type of exposure. You're going through somebody's stuff, you're bringing it in evidence, you are perhaps just helping a person who is potentially had an overdose, and you come in contact with it. There are some stories here. A lot of this, unfortunately, is anecdotal as to what the risks are to police officers, but they're very real, including a home Ohio example of a suspected overdose patient who had to, when the police arrived, the paramedic actually was exposed and had a potential overdose. These are real things that are happening even in our state. Next slide, please. There, of course, you can use PPE, personal protective equipment, and there are standards that the DEA and others put out. You can see it on the right-hand side of this page: nitrile gloves, latex gloves don't work, gas mask, eye protection, disposable paper suits, paper overalls, and of course this ratchets up if you are in an area with known amounts of opioids or opioid production. However, it's very hard sometimes to even tell you're going to need all this stuff. You wouldn't just walk into a normal police interaction with these things and you might be accidentally exposed. And so, of course, there's all sorts of measures about how, if you suspect it's an opioid, you should treat it. But like I said, Narcan, this antidote for opioid overdose, is the backup in case you are exposed. So that person in Fairborn who had the overdose accidentally was treated with Narcan and was able to come off of the high unfazed. Now, next slide. Now, there are other technologies that could advance this. So, of course, there's technologies around PPE, but since you don't always know to wear the PPE, technologies that maybe can detect that there is presence of opioids would be something that would be the type of thing that this challenge would hopefully be investing in. And so some examples here that require only swiping the outside of a closed bag to know whether it's in there, something that can detect very quickly without contact the drugs, or even equipment back in the lab. Of course, price is an issue here, right? You want these things to be readily available to, the many people who could be potentially exposed to this. And, how do you create a price point that it actually makes sense? There are advances. So the Narcan administration, right? So there are multiple options for administering it. If you talk to police officers recently, having intranasal and a dispenser that's easier to dispense has definitely improved the ability of departments to be able to use those drugs, and for police officers with relatively little training to know what to do if they're accidentally exposed. Next slide.
Great, thank you very much, Ethan.
So before I turn it back over to...
Sure, go ahead.
Go ahead.
Please proceed, Ethan.
Oh, I was just going to say, so I guess my advice for everyone here thinking about this submission is to think of the broad range of different activities that you would think of being involved in trying to prevent yourself from having an opioid exposure, realizing that it's just absolutely everywhere, and to really just think about how technology could be used in any one of the different stages to prevent exposure, limit exposure, and of course treat exposure of first responders. And I'll just throw this in there. I didn't see, and I'm not aware of any specific instances where canines have been affected, but that's a problem too. That same amount of drugs can affect these well-trained canine dogs. So just another angle for you all to think about, and good luck.
Great, thank you very much, Ethan. Kevin, we've heard from both you and Ethan about this topic kind of in broad terms. Could you tell our listeners a little bit more about possible approaches, items they should include in their submissions?
Right, so the minimum requirements for submissions. Your solution must use technology as a component of your approach. So sensors, diagnostics, medical devices, pharmaceuticals, and/or health information technology. You can also use software, but it should be in conjunction with one of those technologies above. You should already be working on your approach. You're going to need to have proof of concept with compelling data to support the effectiveness of your approach. You should have a clear plan and path forward to get your technology ready for broad deployment or implementation. And your approach must be able to be implemented in the United States. So it should be likely to receive regulatory approval here, and you need to be able to demonstrate your approach in conjunction with an Ohio-based entity if you make it into the product phase. Next slide. Okay, so what does not qualify? The following approaches do not qualify. Those that are strictly at an early concept stage of development, solutions that require changes in current law, policy, or regulation, clinical treatment protocols that are not associated with a new technology development, alternative pain management therapies, predictive analytics that inform public policy, programs for direct delivery of social or clinical point of care services that do not have a significant technology component, education and public awareness programs, and professional training programs. Those broad categories of approaches are not eligible for the contest. Next slide. All right, so what are the general evaluation criteria? How does your approach align with the key attributes of the topic, which I'll get to in a moment? What's the maturity of your technology and the time to market? So for similar approaches, preference is going to be given to the one that is more mature and or that has a shorter time to market. What's the potential for broad deployment or implementation? What is the size or scope of the audience impacted, the so-called market size? An assessment of robustness and effectiveness of your approach. So what are the key attributes for topic 4? Well, your approach should prevent, minimize, or counteract exposure to opiates. It should be fast-acting, preferably in 1 to 60 seconds. It should be simple to use. It should be robust for field deployment. It should require minimal space, so be portable for use in a first responder vehicle, for example. It should have a unit cost that would enable widespread deployment. As Ethan indicated, a $50,000 device isn't very easily replicated and deployed widely. It's expensive. Okay, so the next slide. If you're talking about opiate detection equipment, your device should detect the presence of legal and illicit opioids and mixtures of those materials. Preferably, the device should be able to discriminate between several opioids, preferably enable detection of related substances, and preferably be able to detect trace amounts. As Ethan indicated, only a few grains of micrograms is enough to cause harm. Preferably, the detection equipment should minimize exposure of the person conducting the test. So ideally, it would be non-contact. It is not going to be susceptible to interference from other common agents, and it will have a low occurrence of false events. So what are possible approaches? Well, they may include, but aren't limited to, the following. Could be novel personal protective equipment. It could be a medical prophylactic. It could be portable diagnostic or screening equipment. It could be portable or permanent placement equipment. Now, what do you need to include in your submission response? This slide, the table on this slide, which is also replicated in the challenge summary on our website, indicates all of the components, the elements of your response. And I'm not going to read through these here. You can peruse this on the website. We are limiting you to about 18 pages of content, and you do have the ability to provide a linked video if you wish and upload up to 3 supporting documents. So what is the timeline? Well, the challenge phase launched at the end of February. We are here today conducting the webinar on the 23rd. The deadline is July 11th at 5 p.m. Eastern. The challenge phase prize recipients will be announced September 18th, 2018. The product phase begins thereafter and goes through July 2019, and then the post-challenge is 2019 through 2021.
Great. Thank you, Kevin. It's now time for the frequently asked questions. These are questions that have either already been asked via the 9 Sigma Provider Help Desk or are questions about 9 Sigma projects in general. Our first question, could you please explain what you mean when you say that an entrant must be registered to do business and be in good standing in the state of Ohio?
So regarding registration to do business in Ohio, please take a look at the website that's listed here on the slide. This is a state of Ohio site that has 2 forms available. The form 530A is for profit organizations, and form 530B is for nonprofit organizations that are non-Ohio entities. So if you're not from Ohio, you can respond to the challenge, and you would need to be able to fill out one of these 2 forms and pay the registration fee of $99.
Question 2, when do I need to register to do business in Ohio? Before submitting a response or before accepting an award, if I'm chosen to receive an award?
Okay, so you do not need to register to do business in Ohio in order to submit a challenge response. If your submission is selected as a winner, you would then need to register to do business in Ohio before accepting the award.
Question 3, who is eligible to compete for the product phase?
The product phase will only be open to the winners of the challenge phase. Only those winners are eligible to compete.
Do I have to fill in each section of the online response form, or can I prepare my submission as an attached document?
You can do either. We ask that you, in either case, you pay attention to the list of elements required, that slide, how to submit elements of your response. Please adhere to the page limits, and remember that you can upload supporting documents and provide a video link.
Question 5, what will be required of challenge phase winners to be able to compete for product phase awards?
Challenge phase winners are going to be required to execute a non-disclosure agreement with 9 Sigma and submit a more detailed plan that explains tasks, timeline, and deliverables that you plan to follow to continue development of your technology for deployment or commercialization. You will also need to explain how you're going to involve an Ohio in-state entity in your effort. Then, during the period from approximately October 2018 to July 2019, you work against your plan.
Okay. And question 6, what will be required of product phase winners after they accept their award?
Winners of product phase awards will be obligated to deliver periodic reports to 9 Sigma from Q4 of 2019 through Q4 of 2021. 9 Sigma will ask you to provide some information that will be disclosed to the state of Ohio. Other information will remain confidential. We'll have further details available before the product phase starts.
Great, thank you for that, Kevin. It's now time for the live Q&A portion of today's webinar. If you have questions, this is an excellent opportunity for you to pose those questions directly to our speakers. If you think of a question for our panelists outside of today's webinar, don't worry, we can still get you the information that you're seeking. In an upcoming slide, it will have some information about how you can request additional assistance from 9 Sigma. With that in mind, we will begin our questions today. Okay, so our very first question. In the challenge summary, you indicate that a solution shouldn't allow interference from quote-unquote common agents. What sort of common agents are you referring to?
So that would be things like solvents or other carriers the so-called inactive agents. If you're thinking about, a pharmaceutical, let's say a pill, that could consist of some small percentage of active ingredient that you would be actually wanting to detect, mixed in amongst, a fair amount of inactive material. And the idea is to be able to identify the actives.
Okay, great. Thank you, Kevin. Our next question, can you provide estimates for the number of first responders or law enforcement officers, emergency medical personnel in the state? And I'm assuming the state meaning the state of Ohio.
So in the state of Ohio, if you look at Bureau of Labor Statistics, which are available on federal government website, you can do some searching around there and find how many people are working in different occupation codes. Just protective services, you're talking about over 118,000 people. If you consider everybody who could be in the healthcare system or in social services or mental health or counseling environments, you easily jump to over 715,000 people in Ohio who have some potential for exposure.
Okay.
And I would say, this is Ethan, I would add to both of those that so for the number of people, you also have to think of who has the most exposure versus not. So in a police force, I mentioned, okay, so somebody has 50 times that they're being exposed, but you could imagine that would go up if you're an EMS provider, for example. So, I mean, there's multiple levels. That's a huge number, but there are multiple levels of how much exposure or how likely it is that the exposure could be very harmful. And on the compounds question, it's a good one, because if you think of all the different things that fentanyl and others could be cut with, it's pretty enormous. So having that in mind is important.
Great. Thank you for that, Ethan. And actually, I think our next question would probably be best addressed to you. So the question is, can Magnet connect me with a manufacturer who could produce my technology?
Absolutely. Our role in Northeast Ohio and through the network of Manufacturing Extension Partnership, which is what we belong to through the Ohio Development Services Agency, our goal is to help small manufacturers grow. And so we have very wide-ranging networks across many different areas of manufacturing that could help with creating the technology, could help on the pharmaceutical end. We could find the manufacturers who could both produce it, but also we have technical competence that could help somebody actually design it or help with the right, in certain areas, the right chemical formulations. So we have reach into the academic institutions, if you're not already a part of one, to be able to bring them into the fold. So NASA, so we have wide-ranging networks that we can bring to bear to help make real some of these technologies as a partner.
Great, thank you for that, Ethan. Our next question, I think, would probably go to Kevin. The question is, we have a case management solution that provides care coordination for at-risk individuals. And the question is wondering whether or not this would fall under the technology solution for either for this topic or one of the other topics, perhaps.
Based on that description, I would say that probably is more likely to apply to topic 3, the connect topic. That's about providing interventions to avoid or address relapse. So if your case management tool somehow, isn't just a matter of like data management, but is something focused on providing interventions, it's probably topic 3.
Okay, great. Our next question coming in just now, if my technology is not portable, but is designed for use in a hospital setting, would that disqualify me?
So, not necessarily. I mean, we talked about the ideal sort of portability case being something small enough to put in a responder vehicle, but if it's something that requires installation, some in some semi-permanent manner or is on something like a cart, it could still have utility in a hospital setting, and so the answer would be to submit a response.
Okay. Our next question. Okay. If my technology cannot currently meet the requirement to be fast acting in that 1 to 60-second time frame, but likely will be able to do so by the product phase, should I still respond?
Yeah, absolutely. We understand that technologies are developing at different rates of advancement. If you have something that's a little slow but functions, and you're able to work on speeding it up, that's part of the deployment.
Okay. Before we proceed to our next question, I'd just like to reiterate to our attendees that this is an excellent opportunity for you to pose your questions to Ethan or to Kevin and get information right away. With that in mind, I'll proceed to our next question. What would an ideal solution for protecting anyone from an inadvertent opioid exposure look like?
So Ethan, I'll start. The conventional protective equipment that Ethan described is effective, but it's cumbersome. It takes time to put it on. It limits dexterity. It's less than comfortable. If one had a portable non-contact detector that could survey a scene, say a room or some part of the volume around a victim, and then notify the user that dangerous substances were present, then you'd know whether or not to take those counteractive measures and don that PPE. Have justification for doing it, as opposed to having to do it every time and be sort of encumbered by less than comfortable stuff. Now, if one could wear a device that somehow monitored one's vitals and then sounded an alert or possibly administered an antidote automatically, if that wearer was exhibiting physiological signs of overdose, let's say, then you could feel more confident that regardless of the scene, you could have some protection from inadvertent exposure.
Okay. Thank you, Kevin. Ethan, would you like to add to anything that Kevin just said?
I think he covered it.
Fantastic. Great. At this time, I think we'll take a slight pause while we wait for our next question to come in. And actually, one is coming in just now. Does non-pharmacological therapy or non-opioid treatment options that include a technology solution that integrates with EHR a possible solution? EHR being electronic healthcare records.
That's sounding a bit more like topic 2, prevent. So take a look at the other challenge topics. It's probably not topic 4.
Okay. Okay, we'll wait just a moment here to see if we have any additional questions. As I said earlier, if you think of a question outside of today's webinar, don't worry. In the very next slide, I'll have some information about how you can request some feedback for that question.
As we're waiting, this is Ethan. I will put out there, and Kevin, you can speak to this one as well. As you talk to professionals in this field, training is also a big deal. And that's not exactly under the purview of this particular technology, although I imagine there are technology solutions that might border on that. But training definitely would be a component. If a technology needed to be deployed, it would definitely be able to be a
component
of deploying that technology, but not training in and of itself is not something that really this challenge is focused on. Kevin, is that accurate?
Yeah, that's correct, Ethan. Training as an element of deployment for the technology is okay. Training on its own is not of interest.
Okay. Great.
Just want to recognize that training is a big deal, and we see that, but that's not what this is focused on.
That's right. Great. At the moment, it looks like we don't have any additional questions coming in, so I'll go ahead and proceed to our final slide. Thank you, gentlemen, for answering those questions. For those individuals that submitted questions, thank you very much for doing so. So, what can you do today? First and foremost, obviously, you can visit the challenge page. The URL is up on the screen there. While you're there, you can register to receive updates about the project. It would be helpful. Additionally, if you need information or assistance outside of today's webinar, you can reach out to the 9 Sigma Solution Provider Help Desk. 2 ways to go about doing that. Number one, you can send us an email. The email address is phd@9sigma.com. That email address, once again, is phd@9sigma.com. Alternatively, you can give us a call at area code 216-283-3901. Once again, 216-283-3901. Happy to take your questions either via email or by phone. And one last and very important piece of information, the submission deadline. The submission deadline is Wednesday, July 11th, 2018 at 5 p.m. Eastern Time. Please be sure to submit your responses in advance of that 5 p.m. deadline. We won't be able to take any submissions after that time. And with that, I will say thank you very much to our panelists today, Ethan Karp from Magnet and Kevin Andrews from 9 Sigma. To our attendees, thank you for joining us and thank you for your questions. We look forward to your responses. Thank you all once again and have a great day.